Yeah, thank you. Yes, such a great answers from both of you. Thank you. And building on your answers, also, of course, I have another question. How does training at the Beck Institute change the way therapists practice CBT? Because, with many CBT trainings available, many trainings available, why do you think learning through Beck Institute is especially valuable?
So one problem that I see among therapists is that they get very good at learning techniques, but they are not very good necessarily in conceptualizing the client and building a really strong therapeutic alliance. So all of our trainings emphasize three things from the very beginning, and we mention this in every training. The first is understanding the client's difficulties in terms of the cognitive model, also understanding their strengths, their problem-solving abilities, and their resources, which is important to see them in a more balanced light, since often when they present, we mostly see the psychopathology. So it's important to develop both a strength-based and a problem-based conceptualization of each client. And then you need to use this conceptualization to plan treatment, both across sessions, especially looking at what are the principles of treatment for the patient's disorder or disorders that have been demonstrated through randomized controlled trials to be effective, and incorporating those into the overall treatment plan. And then also doing many conceptualizations at every single session to try to figure out where it is that our work with this patient at this session at this time might be most effective. So when you think about the cognitive model, that it's not a situation that directly leads to the person's reaction. Really, it's the person's interpretation or perception of that situation, which gets translated into automatic thoughts or images that just go through their minds. It's these meanings translated into thoughts that are more closely connected to their reaction than the situation itself, their behavioral, emotional, and physiological reaction. So, that's the basis of all treatment. When we're looking at recovery-oriented cognitive therapy, which maybe I can talk about in a few minutes, then we're also looking at what are the patient's positive beliefs that help the patient then persevere or cope more effectively in a situation that could potentially be challenging to the patient. So at every session, we're trying to figure out where to start working. Are we going to work at the level of the automatic thoughts? Are we going to intervene, do some problem solving at the situation level? Are we going to help them respond to their automatic thoughts in some way, either evaluating them and responding to them, or perhaps diffusing the automatic thoughts and detaching from them, especially if the client is in a dysfunctional thought process like obsession or rumination? Are we going to work at the emotional level, maybe teaching them some techniques to manage their emotions better? Are we going to work at the behavioral level, teaching them some needed skills or discussing what else might be done in this kind of situation? Or have their bodies become very aroused as they might in someone who has an anxiety disorder? Are we going to teach progressive muscle relaxation or mindfulness or something else to calm down the body? So are we going to work at that level of, what has happened, in this past week or is happening right now in session? Or are we going to go back and look at what are the patient's core beliefs? We probably do this more toward the middle of treatment. What are the core beliefs, their most basic understandings of themselves, their worlds and other people, and sometimes of the future? And we might be looking at the meaning that they put to certain events in their life that help us understand why it is that they developed those beliefs. Or maybe we're going to look at their coping strategies, these patterns of behavioral patterns of behavior that the client engages in. And if we're looking at their psychopathology, it's that they are engaging in order to usually to protect themselves from the activation of the core belief. Or we might be looking at their assumption level, the intermediate beliefs, so that we can understand why it is that the patient is behaving in this way. It should always make sense to us. We should always say, well, no wonder the patient has this pattern of behavior. It's because he or she has this assumption. If I use this behavior, then I'll be okay, at least for the moment. But if I don't, my negative core belief about myself, others, or the world might come true or might become very evident. So it's incredibly important to develop really accurate strength-based and problem-based conceptualizations of the client, and then to use our conceptualizations when we're planning treatment, either across session or within sessions. And it's particularly important when there are problems in the therapeutic relationship. So if a problem arises, a patient gets angry at you, patient won't say anything to you, the patient chronically on purpose comes late to sessions, the patient criticizes you, the patient lies to you, the patient tries to manipulate you, and so forth. Whatever these challenging behaviors are that arise in the context of the therapeutic relationship, we have to be able to conceptualize them. Why is the patient using this behavior right now? Is this behavior part of a pattern? Maybe it's really a coping strategy. Has the patient's negative core belief become activated? And so now it makes sense that the patient would use this unhelpful coping strategy with me right here in the session. So what I think the Beck Institute has to offer, probably over and above most training programs in CBT, is this very strong emphasis on conceptualization, treatment planning, and the therapeutic relationship. And then we start to teach our trainees about techniques. Dr. Jenna?
Yeah.
Rebecca, it's so incredibly hard to follow such a complete answer. I think that maybe just to highlight one point, while other training institutions might be teaching one part or another, here we truly are providing a full wraparound scope of treatment. As Dr. Beck mentioned, from the therapeutic relationship, which we never forget about, because it's so incredibly crucial to everything that we do and set up with a patient, to the conceptualization and then intentionality with which we select and understand everything that's happening in the session, to actually teaching the techniques, which we do very, very well as well. So if somebody is interested in learning CBT holistically, instead of learning it in parts, they should definitely come and check out our training.